participation. We will return to it. But at this point, I will call upon the County Administrator, Mr. Rapsaro, to introduce the panel.
Thank you, Mr. Chair. Again, we collected questions from the commissioners regarding the order and questions that they had perhaps received from other parties. We've tried to compile those and build a presentation around those questions as best we can. So we plan to start with that presentation and then, of course, try to address any follow-up from the board. With that, it is, frankly, my pleasure to introduce our health officer, Angelique Joins, to help present this material. And I know with her, she has our public information officer, Lindsay Mons, who I believe is available remote and will make the presentation, and also our medical director, Dr. Rick Tooker, as well. And with that, I'd like to turn it over to Health Officer Joins.
Lindsay Mounds, our Public Information Officer. She's going to walk through the presentation, and then I will close up with comments and take any questions. So I'm going to turn it over to Lindsay Mounds, our Public Information Officer.
Thank you, Angelique.
Thanks, Angelique and Commissioner Story. Can everyone hear me okay?
And now, Lindsay, thank you.
Great, thank you. So as Rob and Angelique mentioned, my name is Lindsay Mounds. I'm the Public Information Officer for the Allegheny County Health Department. I want to thank the board for the opportunity or the request for presenting some of this data that we have put together regarding the Allegheny County Health Department K-6 mask order. So first, I want to start off by asking, what is public health? And public health is the health of the population as a whole. And we've heard a lot of legal terms today, but I'm going to remind or mention again the MCL 333.2433, where it states a local health department shall continually and diligently endeavor to prevent disease, prolong life, and promote the public health. Now, individual health is the state of being free from illness or injury, and it's on a person-to-person basis, whereas public health looks at, again, the population as a whole. So while a doctor treats people who are sick, public health professionals try to prevent people from getting sick or injured in the first place. So on your screen, you will see three graphs. The first one on the left is the Allegheny County COVID-19 cases by referral date, so since the beginning of the pandemic. This is our epi curve. And to the right is the Allegheny County COVID-19 school age cases by referral date. And these are cases when strict mitigation strategies were in place. And on the bottom, we specifically have Allegheny County aged 5 to 11 cases by referral date. And so I will continue with some of our local data. We also, when looking at what's happening and the COVID data we look at is percent positivity. So how many people are being tested and positive for COVID. Currently, as of the 18th, Allegheny County has a 13.4% positivity, and that is considered in the high level of community transmission as defined by the CDC. Something that we also continue to monitor and look at is the vaccine coverage in Allegan County. And the map you see here is the vaccine coverage broken down by zip code. And so the greener it is, the more vaccinated individuals there are. They've received one or more dose, and it's the percent of ages 16 and plus. So we've been asked, what it was our roadmap to decision making. We have met weekly, and starting in the summer, we met bi-weekly with school superintendents. And throughout those meetings, we've continued to emphasize mask wearing is strongly recommended. We've had meetings with our legal and other Michigan local health departments. And recently, new guidance from the American Academy of Pediatrics, CDC, and MDHHS strongly recommended universal mask wearing in schools. And so on August 11th, we released updated COVID-19 school guidance, again, strongly recommending masks in the school setting, universal mask wearing. And currently, we're in a high level of community transmission in Allegan County. So that means we're seeing more virus and more cases happening within our county. We continue to provide surveillance of do surveillance of other communities, states at the peak of their surges. And we also continue to look at coverage on county level, zip code level, and by age group. So some of the recent questions we've received from our board on the mask order is why this age group? So kids 5 to 11 do not have an available COVID-19 vaccine. So these kids 11 years and younger must rely on mitigation strategies to be protected from COVID-19. And the next best thing to vaccines that we have are masks, and they're an effective form of prevention. Another question that was asked was the psychological impact to kids considered? And yes, we evaluate risks and benefits with decisions that need to be made. Allegan County Health Department has prioritized in-person learning for kids since the beginning of last school year. And schools were in person or hybrid with masks in place since last year. And kids and other vulnerable populations continue to be prioritized for timely case investigation or contact tracing, no matter what our epidemiological curve looks like. And also the health department has concerns about interruptions in the school due to quarantines and positive cases. Another question we received is, what are other counties doing? Currently, Genesee, Kalamazoo, Allegan, and most recently, Ottawa and Kent County Health Departments are 5 that have issued mask orders for the K through 6, or Ottawa and Kent actually goes to pre-K through 6 orders. Another question we have is who is excluded? So this order does not apply to persons in the act of eating or drinking, persons outside if not engaged in activities involving direct physical contact, persons under the age of 5 years. However, supervised masking is strongly recommended. Students with developmental conditions of any age attending school, although supervised masking is encouraged. Teachers who are working with children who are hard of hearing, or students with developmental conditions who benefit from facial cues. These teachers or staff must be vaccinated or comply with masking directive. A person with a disability who cannot wear a mask or cannot safely wear a mask because of the disability defined by the Americans with Disabilities Act and the Michigan Persons with Disabilities Act. We've also been asked, why is this being handled differently than the flu? So I'm going to point to the recent flu season we've had, and in Southwest Michigan, we've had 0 positive respiratory virus results, and Allegan County resides within Southwest Michigan. To the right, we have pediatric deaths from flu-associated cases in the US and in Michigan. And you can see in the 2020-2021 year that we've only had one death in the nation due to flu in the pediatric age group, and 0 deaths in Michigan. Now, according to the CDC, this past year, we've had 490 children under the age of 17 years that have died of COVID-19 in our nation. Another question that has been asked is there any compromise? While we don't have any compromise, we want to emphasize that this order remains in effect until 6 weeks past the date a COVID-19 vaccine is authorized and available to persons 5 years age through 11 years old, or until further notice from the health officer. And if the CDC level of community transmission is low for at least 7 days, the health officer would rescind this order. And why do we look at the CDC level of community transmission? Well, it's not the only point we look at. This tells us that when we're in low transmission, there's less virus within the community, and there's a lesser need for strict mitigation strategies. So now we'll highlight some parental concerns that have been shared with the Allegan County Health Department. 1, masks are not effective. 2, school outbreaks pose a risk to my family. Another concern is other people not wearing masks and the health of my child. Masks are harmful. The Delta variant poses more risks for kids. I can't get my child vaccinated, and the virus is too small for masks. Now, these are just some, so we know that there's more. And before we talk about masking, I want to talk more about universal masking versus individual masking. So when universal masking is in place, masks prevent infected persons from exposing others to SARS-CoV-2 by blocking exhalation of virus-containing droplets into the air. We call this source control. It is estimated that at least 50% or more transmissions are from persons who never develop symptoms or those who are in the pre-symptomatic phase of their COVID illness. So pre-symptomatic means that they're not showing any symptoms, but they're shedding the virus and exposing others to that virus. In recent lab experiments, a multi-layer cloth masks were more effective than a single layer mask, blocking as much as 50% to 70% of exhaled small particles and droplets. And universal masking also protects uninfected wearers. Masks form a barrier to the large respiratory droplets that could land on exposed mucous membranes of the eyes, nose, and mouth. Masks can also particularly filter out small droplets and particles from inhaled air. Multiple layers of fabric and fabrics with higher thread counts improve filtration. And this specific study, the observed effectiveness of cloth masks to protect the wearer is lower than the effectiveness for source control. So while it protects uninfected wearers, it's more effective for the source control piece I highlighted first. So why masks are effective? Masks are not 100% effective, but they greatly reduce transmission. I'd like to direct your eyes towards the picture on the right side. We have an infected asymptomatic individual without wearing a mask, and below we have an infected asymptomatic individual wearing a mask. Now, asymptomatic is they have the virus, they're shedding it, exposing other individuals, but they themselves are not having any symptoms. So we see here the amount of respiratory particles or respiratory droplets that get expelled into the air, exposing other individuals, rather than for when an infected person is wearing a mask, there's less respiratory droplets and less respiratory particles that get exerted into the air, minimizing the exposure for other healthy individuals. And I just want to highlight the studies of effective mask wearing and the mitigation strategies and how it mitigates risk. I have that as a resource for you if you'd like to look at it. So I want to point your eyes to the right side of this slide where there's a graph, a line graph. So mask mandates implemented after a Delta surge saw slower rates of increases in jurisdictions compared to those who didn't require masking. So the counties, St. Louis County, Clark County, which is in Las Vegas, and Los Angeles County issued mask mandates. And you can see here their average cases per million, or their weekly average cases per million were much smaller compared to the counties that had no mask mandates in place. So another thing we do in public health is look at modeling. And with some mask modeling, we've learned that masks can substantially reduce transmission in school settings. So the posed scenario is if one infectious child attends a class of 25 students, how long does it take for there to be a greater than 50% chance of transmission occurring? And for the purposes of our order and this presentation, I'm going to highlight just the elementary graph. So when no masks are in place, it takes a matter of 3 hours for there to be a greater than 50% chance of transmission occurring from one individual to 25 students. When imperfect masking is in place, so that if a child or parents have their child wear masks in school, there would be a 1 day, it would take 1 day for there to be a greater than 50% chance of transmission occurring. Now, if we have complete masking or universal masking in place, it would take about 5 days for there to be greater than 50% chance of transmission occurring in the elementary setting. And this simulation that was done was assumed, we took the Delta strain into consideration and normal talking, not singing or yelling. Another modeling study that was done was with a collaborative with North Carolina State University, the University of North Carolina at Chapel Hill, and other partners. They had no masking scenarios and universal masking scenarios. And what they found with no masking scenarios was that the effective reproductive rate, or the R0, was 4.0. So that means for every one person infected, 4 other students became infected. And now I know that these lines are small and maybe hard to see. Both these lines represent no masking in place. The blue line represents no masking, no testing, and the purple line represents no masking and testing in place. Now, with universal masking scenarios, they found that the effective reproductive rate reduced by 50%. So it was 2.0 rather than 4.0. And you can see here, the 2 lines are for universal masking, no testing, and universal masking with testing in place at the elementary school setting, where incoming protection is at about 30%. So incoming protection would be some form of antibody protection, whether that's natural or vaccine. So what does all of this mean, and why do we show you these models? The Delta variant is very contagious, and kids under 12 years old are not eligible for vaccines and therefore remain unprotected. Without masks or testing, up to 90% of susceptible students may become infected by the end of the semester, if only 30% have incoming protection, and that was the model that they used. Masks and testing in combination can prevent 40 to 70% of new infections. And this model also looked at the consequences that could happen beyond the classroom or after this semester of school. We'll see additional cases in the community, including among elderly grandparents or other vulnerable family members, especially when community rates are already increasing. And mind you, we are in high transmission level in Allegheny County. More infected students leads to more days of school absences, which causes a ripple effect, not only affecting the students, but forcing caregivers or parents to take time off work to care for their kid. Oh, and the last point is regarding multi-inflammatory syndrome or long COVID, which is two things I will discuss in a couple minutes. So are masks harmful? We've heard a lot of concerns about oxygen saturation and carbon dioxide retention when wearing a mask. And available studies have shown that this statement is not supported, including recent statements from the American Academy of Pediatrics. Children aged 7 to 13 years have been shown to be able to make accurate inferences about emotions of others while partially covered faces. So even if someone has their face mask on, children in this age group had been shown to still be able to tell the emotions of other individuals. And regarding germs and bacteria, proper laundering of cloth masks remove any viruses, bacteria, or respiratory secretions that build up on the mask. So cloth masks can be safely used more than once if you wash them each day. Clean and dry masks will not develop mold or make you sick. Is the virus too small for masks? Although the virus is very small, the virus cannot travel by itself. So it relies on respiratory droplets to go from person to person. And respiratory droplets are very different than smoke or other compositions of excretions. And that's why when we layer mitigation strategies, including mask wearing, it prevents the virus from continuing to be able to travel to other people. And so the Delta variant has changed the game for this response. We're going into more concerning territory as the Delta variant is highly contagious, more than 2 times as contagious as the previous strain, and has a much higher viral load. So with this variant, one person can transmit it to more people compared to previous variants. When the CDC revised its guidance in May, the Delta variant represented 1% of all cases. And today that number is more than 80%. We know children can transmit the virus to others and can be sources for outbreaks. And children can experience severe health outcomes from COVID-19, including MIS-C, hospitalization, and death. Schools are starting full force in-person learning with different mitigation strategies in place. So as a result, universal masking is a proven safe, effective approach to reduce the spread of the Delta variant. And part of public health is doing surveillance of what's happening in other communities and what's happening across other states who are experiencing a surge earlier than our community or our state. So the Delta variant will increase transmission in children. We're seeing it now in Michigan and in Allegan County with last month, the 0 to 9 and 10 to 19 having more cases than cumulatively than what we saw from the beginning of the pandemic. And what we're seeing nationally and locally, so cumulatively, children or child COVID-19 cases have represented 14.4% of all cases. However, we've seen a change in child COVID cases in the past week, where they're now representing 18% of cases, of weekly reported cases on a national level. Now, locally, we're seeing something similar where children aged 0 to 17 make up 14.6% of cases since the start of the pandemic. And in the previous 2 weeks, children cases have made up 20.7% of our COVID cases. And highlighting of what's happening in our nation and in our state. On a state level, Texas is leading with 529 kids hospitalized for COVID-19 as of yesterday when this presentation. This equates to more than 8 hospitalized per 100,000 kids in the state of Texas. As of July 31st, 4,404 kids were diagnosed with MIS-C associated with COVID in the United States. And I know this map is hard to see, but in the state of Michigan, we've had between 150 to 199 MIS-C cases. Thankfully, there's been no reported MIS-C cases in Allegan County yet. So now I'm highlighting hospitalizations among children. What we're seeing nationwide is higher than it's ever been. So the map on the left shows, or the line graph on the left shows the hospitalizations increasing among the 0 to 17. And what's really concerning is of these 0 to 17-year-olds who are hospitalized for COVID, about 50% of them are being admitted with no underlying medical conditions. Oops. And we don't just look at what's happening directly with the children, we're also looking at what's happening indirectly. And while many school-aged children fully recover from COVID, 1 in 20 can experience symptoms that last longer than 4 weeks, and 1 in 50 can experience symptoms for more than 8 weeks. And the indirect impacts of uncontrolled spread in COVID can mean loss in loved ones and caregivers, adverse outcomes to their mental health and physical health, and interferences with developmental milestones. So as I stated previously, keeping kids in school is a high priority for the Allegan County Health Department. Masks help keep kids in school. When we have more mitigation strategies in place, we'll have less interruptions in the classroom, as less people would need to be quarantined than if no masks were in place. And we know missed in-person school negatively impacts children, so we want to see kids in school. And again, we've talked about a layering approach or defense against COVID in schools, or mitigation strategies. So the more we layer against COVID-19, the less transmission that the transmission reduces, keeping our kids in school and keeping our community more safe. So why put this order in place? So kind of summarizing, the best tool for combating COVID-19 is vaccination. However, for the population who does not have access, the next best thing, the next best tool is the protection of face masks. And keeping kids in school is a high priority since the start of the pandemic. Universal face masking is effective. The Delta variant is more transmissible, and the amount of detectable virus of the infected individuals is much higher, even within fully vaccinated individuals. And parents of those under the age of 11 years do not have a choice to get their child vaccinated since this age group is not yet eligible. And finally, this order is effective until 6 weeks after this age group is eligible and has access to an authorized COVID-19 vaccine, or Allegan County is in low risk as defined by the CDC levels of community transmission for 7 days.
So I'm just really quickly going to make a few statements and then I'll be available for questions. So COVID-19 is considered a communicable disease, and health departments implement orders, rules, or procedures to prevent or control spread of disease. This is something that's been done for many, many years. Smallpox, chickenpox, measles through vaccine, TB control through treatment, isolation, quarantine, and testing of potentially exposed. Establishing temperature requirements in restaurants to reduce foodborne illness. Establishing water quality standards to reduce risk of waterborne illness. Universal masking is a safe, proven and effective, reasonable mitigation strategy or procedure to reduce risk of exposure in the classroom setting for this population that is not eligible for vaccine. This order is again time bound. It's time bound to 6 weeks after vaccines authorized for the K through 6, or I should say the 5 through 11-year-olds. Or if Allegan County's community risk level is at the low threshold for at least 7 days. We care about Allegan County as a whole. This is, I know this is a contentious topic, and I can understand everybody's frustrations, and I know everybody wants things to be normal, and I don't think that anybody would want that more than Allegan County Health Department and my team that's worked very hard to prevent the spread of this illness within our community and try to keep you all safe. So I just want to let you know that this, decision we knew that's contentious would not make everybody happy. But again, we had to look at and evaluate the data and look at what would be better for the public's health. Local hospital systems in our region support mask use, and we've reached out to them. Summer schools went fine, and yes, summer schools, we did have some cases in summer schools, maybe not in some of the school districts that we heard people speak from, but also remember that our percent positivity and the amount of virus that was in the community at that time was very low. And so, as we said before, if you look through the layer cheese effect, as our community, as the virus is circulating in the community, there's more mitigation strategies needed to keep the virus, to reduce the virus circulating. I think all of us want to get this virus contained. We don't want this virus to mutate into something that's completely vaccine resistant, and we're trying to keep all people in Allegan County as healthy as they can be until we can get to that time. So I appreciate, the questions. I appreciate the passion, but I want you to know I'm not a bureaucrat. I'm somebody who cares for the health of the community as a whole. Thank you again for your time, and I'm here to answer any questions.
Lindsay, in your slides when you first started, I think several times you just mentioned more cases of the Delta variant. Could you go to the 5 and 11 to give me an idea? How many kids are that in Allegan County? And then when you said more cases, what does that mean? You have 2, 10, 100? When you made that statement, can you try to give us the numbers as far as how many kids, when you said more cases, how many more cases in actual number for Allegan County?
So our children cases currently make up 20.7% of our COVID cases in our county, and that's from the previous 2 weeks. So in the previous 2 weeks, we've seen 208 cases and 280 cases, and 58 of those are children in the 0 to 17 age group. Through the course of the pandemic, You know, we have 11,697 cases in Allegan County, and 1,705 of those are from children in the 0 to 17 age group.
So you did chart it through the, through the mask mandate. You're looking at 5 to 11 as charted, or not?
Yeah, I can just speak to that. It's not going to be exact, but 5 to, it's actually 5 to 13. We had, since the start of the pandemic, around 460-ish cases. I don't have, and that was as of, I believe, August 4th. And so that is 44% of the 14.6.
Angela, can you give me an idea of, so those cases, were most of them hospitalized, and was there anybody that died?
Yeah, so I think somebody else presented on that, but yeah, we can talk about that. So that was previous to the Delta. So nobody 5 to under 18 has been hospitalized in Allegan County nor died. Yep.
Commissioner Jessup.
I may, thank you for coming to me. I may have misunderstood something here, but when I look at the number of students who are potential in Allegan, I get like a no risk to me. I mean, one child maybe at all of Allegan County statistically would come down with COVID. Is that correct?
Well, I mean, we had 28. How many did we have last week, Lindsay? You just said it.
I'm looking, yeah, you gave me some numbers earlier. I'm looking at this K to 6, but you had a statistic there. It was 20 out of so many kids.
There's,
Maybe I read it right.
So
that's part of the.
I'll repeat it again. In the previous 2 weeks, children cases in Allegan County have made up 20.7% of our COVID cases. So out of the 280 cases we've had in Allegan County in the past 2 weeks, 58 of those have been in children 0 to 17.
58 out of 8.
Yes, we had 280 positive cases, and 58 of those were in the 0 to 17.
One other question on schools. These are just for Allegan County schools. I mean, there's a lot of children that live in Allegan County that go to Ottawa. I don't know if Ottawa has it. Van Buren doesn't. Other schools that are not doing it. What about those kids?
Yeah, so that's where it always gets interesting with communicable disease. So it is actually, when we did the order, it's for the school district. So if you look at the order, it's for the educational institution. So it would be for all kids who attend that school, educational institution.
So
And that those educational institutions would need to be in Allegan County. We only have jurisdiction over institutions within our health jurisdiction, which is Allegan County.
So anyone, say in South Haven or Bloomingdale, I mean, those are my district areas, those kids are not under this kind of mandate.
Van Buren and Cass, I don't believe have
Because you don't
done
have
the order.
authority. And what type of mask are you recommending here? I mean, the N95 is what we always hear is a safe mask, but most masks I see are medical masks.
I think that, we like, there's all different qualities of masks. I guess the most important, there's a couple important factors to consider to make sure a mask is got 2 layers at least. Obviously, make sure it's clean. You want to make sure that you don't have gaps, a lot of gaps on the side or the top. But again, when we talk about source control, and we know that it doesn't prevent COVID, if everyone wears a mask in a room, that there's still a chance of people can get COVID. What it does is it reduces the amount of respiratory droplets, so it's a source control. And so the better your mask sits around you, the more likely you're going to be in not spreading as much of the virus to others or having respiratory droplets potentially seep in, but it's not going to prevent it. You're welcome.
Commissioner Dugan.
Thank you, Mr. Chair. So for clarification for the record here, when you go and give an order, and I'll take public schools since that is in my district, even though that district extends clear down to M43 in Kalamazoo County, your authority for that order extends to the school district, no matter what the political boundary is, correct?
Yeah, it's for the school district and not, that it's in. So this is where it always can get a little complicated, but, we did it, the orders for the, educational institution, to, implement the requirements. So it's, not necessarily residents that might be outside of our county.
So, and all deference to the Commissioner Kane, Plainville School District extends approximately the same length into Kalamazoo County too. Would this be why you joined with Kalamazoo County to issue this order?
Yeah, we met with I won't say that that's exactly why, but we met with all of our surrounding counties as part of our decision making. And, part of our decision, we realized that there are students who might be across jurisdictional boundaries. And at the time, we knew that some of our schools have already been in session, and that some schools were starting session this next week. And so we knew that our timing to do our orders wasn't going to be able to align, because we wanted to be able to give schools and parents more lead time if possible. But that was part of our decision making, was meeting with our other local health officials, their team, and talk about being proactive and preventing before Delta's here and our hospitals are surging.
Thank you very much.
Mr. King.
One of the issues I have with this is lack of local control. When you look at the issue of this mandate, look at local control, school boards, and I think Mr. Lombard was good points. School people care about the kids. The
So
lack of local control really concerns me. There's a difference between market and selling.
yeah, I understand that. So I just, and maybe we can do it better or differently, but we've been meeting with the superintendents from every school district since the start of the pandemic weekly. So every Wednesday morning, we were meeting with them, and then that went to every 2 weeks during the summer. And we talked a lot about this, and we, talked about, we just talked, so maybe it wasn't the Board of Education, maybe it wasn't the principals, but there was a lot of discussion with the superintendents around this, and we did strongly recommend. We explained the why, we went through the data, we understand that for various reasons, the boards of education, did not, they, at the end of the week before, they were all leaning towards not requiring masks and making it optional. And I think you can see across the country, boards of education being put in positions where they're not health experts and having very contentious and a lot of pressure on them to make choices that they're not experts in. And I completely understand local control, and I understand all of that for really, everything that really happens in a school setting, whether it's curriculum, busing, schedules, and if it wasn't a pandemic, I don't know if we would be here, but I guess my concern is what is the right thing, and I think the rub is individual health choices versus public health impact, and I think there's a rub that never really quite lines up, and I'm responsible for the public health impact, and I don't know how to fix that because everybody's collective individual choices impact public health outcomes. And I think what we're trying to do is look at what's going on in other areas. I mean, we have school boards going against governor orders right now in other states because they have people sick, children hospitalized, children dying and whole classes and schools being quarantined or isolated and not able to attend. And I think we are trying to get ahead of the curve on that so that we could do something that's reasonable, safe, and effective for a time-bound period of time to be able to mitigate any increases, cases in our schools and outbreaks where we're going to have to, isolate and quarantine. So I'll just leave it at that. But I mean, I completely understand that.
Okay, the other little problem I have with that is the board members get elected, superintendents don't. Just like our county administrator doesn't get elected, we do. It's important that we listen to our community. Look at the scientific data, shoot that. But I just strongly feel that recommend versus mandate.
Next. Questions? Commissioner Jessup?
What did you do last year?
What did, as
I mean, for school, health-wise, I mean, schools,
the mitigation
what did the health department, I mean, did you mandate this last year as well? Or what?
it was, we didn't mandate it, it was mandated through, they had that back to, it's not in my head right now, but the back to school, my school plan, it was under the governor's my safe school plan. So that's where the mitigation strategies were in place through last year, throughout the year.
Well, it's kind of like Commissioner Kane, I mean, I'm a local control, and if it worked that way last year, schools made their decisions on what they were doing and how they were doing it for the most part, and I'm a little confused why we
They didn't make their decisions.
Okay,
yeah.
But they did do something different than you're mandating at this moment, and it seemed to work. That's my point.
Oh, okay. I think that I think the schools were, I mean, I know that the schools had to follow, there were certain orders that were in place that they needed to follow, and that came actually from the Michigan Department of Health and Human Services. So those were lifted in June 22nd, 2021, and cases were low, and virus, the positivity rate was low. And now we're seeing that increase, knowing that the Delta variant in other areas is circulating, and like they projected 80% of our cases are Delta variant.
Did Angelique told that Dr. Tucker was going to join us? Is he now available?
I am here, Commissioners.
Thank you, Dr. Tucker. Do you have anything
Welcome.
to offer to us as you part of the panel that was advertised to us?
Sorry, can you repeat the question?
Yeah. Do you have anything to add to the presentation from Lindsay Mounds and Angelique Joyce? And
You know,
just a minute, Dr. Tucker, just for those who are joining us both in person and 112 that are joining us digitally. Dr. Tucker is our medical officer and is principal advisor on medicine to our health department. So go ahead.
thank you. You know, we wouldn't even be here having this discussion other than the fact that we have a high level of the Delta variant transmission here in Allegan County. And it is a very serious problem. It's not the original COVID-19. It is a very infectious and very disease-causing potential viral agent. So I would say that because of that, this situation and the unfortunate timing with the beginning of schools, that medically, I do believe we have an imminent danger that we must respond to as the health department. Thank you.
Thank you. Commissioner Capping has a question.
Dr. Tucker, if sure is what you described, how would you come up with this mandate from 5 to 11 and you wouldn't include all high school kids? As far as, if it's true for one, isn't it true for all? Or how do you make the distinction then and go, oh, wait a second, we'll just affect this one age group?
Yeah, can you go back?
How'd you come up with that?
Lindsay, can you go back to the slides? So we can just reiterate, is there a way we can pull up this? Yeah. Just go back to that slide. So I think I can speak to that, and Dr. Tucker as well, that in like public health utopia or the perfect world, we would love to have, universal masking for K-12. And actually, when we're in high community transmission, that they recommend universal masking with the Delta variant right now, because it does, vaccinated individuals can get it. They might not have any symptoms, but they can transmit it. So we are not getting sick from it, but we can transmit it. So they're recommending everybody who's in indoor spaces for that. So we, in the perfect public health world, we would want everybody to do that, but what we know is that's not reality. And so we know everybody has a choice. So we know that everybody 12 and above in the United States and in Allegheny County have access and a choice to vaccine that helps prevent them from serious illness and death. And that is why we focused on the 5 to 11-year-olds, because right now those parents don't have a choice to get them something that potentially they could die from. So that is why that's why the 5 to 11 was chosen.
Good. Anything else? Matt? Lindsay, Dr. Tucker, thank you for joining us.
Thank you.
Okay. We will